Hello, today I'm going to access and deaccess an implanted port in my patient. Um, I have verified my order. I have took and did all my safety practices and washed my hands, two patient identifiers, knocked, greeted, identified, told the patient what we're going to do. So I'm going to put on some gloves. What we want to do first is we want to palpate the site. I'm looking just to make sure that there's no inflammation, no redness or anything like that. I'm using my non-dominant hand on this. Okay, I found it. Everything looks good all the way around it. No, nothing out of the ordinary. I want to take these gloves off and discard of those. I am going to apply my sterile gloves. I've also already flushed the port that I will attach to the Hubble needle, and it's ready to go. Drop that. First, what I want to do is I want to take my chlorhexidine prep, and I'm going to work from the center of this outward. I'm going to scrub that for about 30 seconds around, up and down, side to side, all the way around it, ensuring that it's good and clean. Once I've done that, I want to let this air dry. I don't want to rub it, blow it, or anything like that. We're going to let it air dry. Once that's done, like I said, I have already flushed this out from before I put it on here, so that way it would be ready. I want to hold this with my dominant hand. My non-dominant hand, I'm going to secure the port itself, going in at a 90-degree angle, straight in. You can put a piece of gauze or something in here to stabilize that. I'm going to aspirate a little bit, make sure I'm in there, and I am. I'm going to flush this. I'm going to remove with my alcohol prep. I'm going to clean this very good. I'm going to grab me a new Kuros cap. I'm going to apply and put that on. I'm going to attach this right here with a little bit of tape. Up here on the patient. I'm also going to put a dressing over this, just like that. We'll secure this all the way around it. Okay. That's how you access an implanted port. Now that we've accessed it, we've used what we need to do, we have an order to deaccess that. Throw these gloves away. Give me a new pair. Also, I would have had my patient put on a mask. I would have put on a mask also. I'd have had them turn their head away from everything just to keep the germs and stuff away when I started. Now, to deaccess this, I am going to take my line, a 10 ml flush. I'm going to aspirate, make sure it is working. I'm going to flush it. I'm going to remove this. Then I'm going to remove the dressing. I'll kind of stabilize this needle because sometimes if you pull on them too hard, they will pop right on out, and I don't want it to pop out yet. I'm just holding my dressing, pulling it around, and once I have that done, I will pull straight out. I'm going to apply another dressing. This will go into the sharps container. Put me a piece of tape and another bandage over that. I want to document and record my findings, what we done with it, and how it looked, and what I done to it.